As artificial intelligence systems like ChatGPT find their way into everyday use, physicians will start to see these tools incorporated into their clinical practice to help them make important decisions on diagnosis and treatment of common medical conditions. These tools, called clinical decision support CDS algorithms, can be enormously helpful in helping guide healthcare providers in determining, for example, which antibiotics to prescribe or whether to recommend a risky heart surgery. The success of these new technologies, however, depends largely on how physicians interpret and act upon a tool's risk predictions, and that requires a unique set of skills that many are currently lacking, according to a new perspective article published in the New England Journal of Medicine that was written by faculty in the University of Maryland School of Medicine. CDS algorithms, which make predictions under conditions of clinical uncertainty, can include everything from regression-derived risk calculators to sophisticated machine learning and artificial intelligence-based systems. They can be used to predict which patients are most likely to go into life-threatening sepsis from an uncontrolled infection, or which therapy has the highest probability of preventing sudden death in an individual heart disease patient. The researchers say that these new technologies have the potential to significantly impact patient care, but doctors need to first learn how machines think and work before they can incorporate algorithms into their medical practice. While some clinical decision support tools are already incorporated into electronic medical record systems, healthcare providers often find the current software to be cumbersome and difficult to use. The researchers say that doctors don't need to be math or computer experts, but they do need to have a baseline understanding of what an algorithm does in terms of probability and risk adjustment. But most have never been trained in those skills. To address this gap, medical education and clinical training need to incorporate explicit coverage of probabilistic reasoning tailored specifically to CDS algorithms. The researchers proposed the following things. First one, improve probabilistic skills. Early in medical school, students should learn the fundamental aspects of probability and uncertainty and use visualization techniques to make thinking in terms of probability more intuitive. This training should include interpreting performance measures like sensitivity and specificity to better understand test and algorithm performance. Next one, incorporate algorithmic output into decision making. Physicians should be taught to critically evaluate and use CDS predictions in their clinical decision making. This training involves understanding the context in which algorithms operate, recognizing limitations, and considering relevant patient factors that algorithms may have missed. Next one, practice interpreting CDS predictions in applied learning. Medical students and physicians can engage in practice-based learning by applying algorithms to individual patients and examining how different inputs affect predictions. They should also learn to communicate with patients about CDS guided decision making.